Association here says that there's a Johnson & Johnson vaccine crisis that will further delay the rollout program, which is due to kick off in May. The association's called on government to do everything it can to facilitate the mass inoculation. You'll know, of course, that this week the Health Minister, Dr. William Mkhize, announced that we were pausing our rollout after 6 blood clots were reported in the United States after 6.6 million doses had been administered. We're joined now by the Vice Chair of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good evening to you, sir, and thank you very much indeed for your time. Firstly, do you believe government was right to pause the rollout of the Johnson & Johnson vaccine in South Africa this week?
Good evening, Steve, and good evening to your viewers. Thanks for having Sama in your program. As the South African Medical Association, we don't really believe that we should have paused our program of vaccination or giving the J&J jabs to the population in South Africa. Based on the fact that we do not think that there was a proper thinking around this matter. If you look, there was an announcement before the meeting with the Advisory Committee on Vaccination to the Minister. But secondly, we are looking at the fact that it looks like we did what I call copy and paste approach, where we just took a decision that has been taken in America and applied in our own country without looking at our own context in terms of this is not a rollout in South Africa. It is an implementation study. We are gathering data, and so far we have not recorded any of those cases in our country.
Do you believe then that our rollout should resume? I mean, you want government to resume it as quickly as possible.
That is our belief. We don't even know why it was stopped in the first place. We think we should be, we are far behind as we speak in terms of the rollout. We should be using, as much resources as possible so that we avoid the unnecessary admissions to hospitals and also avoid deaths of people. If you complain about 6 cases in the U.S., not even people who are dead in the U.S., who are only having side effects. What about 75 people who died yesterday in South Africa? Did we make noise about 75 people who died of COVID-19 in our country?
In the meantime, we've seen, putting this issue to one side for a moment, many people have suggested that the rollout of our vaccine campaign or our vaccine program has actually just been too slow generally. Dr. Mzukwa, I presume you want to see it speeded up. The second phase due to start on the 17th of May. I imagine you want as many doses in as many arms as possible.
We were hoping that by now we'll be having enough of vaccination sites and vaccinators so that we speed up the process. But I don't think we've gone that far, and we're still missing out in terms of the rural healthcare workers. So the speed that we're at the moment is not really the speed that really we think as the South African Medical Association we should be using, if we want to avoid further deaths and further bombardment of healthcare facilities.
Is it your members who are now the most vulnerable? Your members are doctors. They're the people who should be vaccinated, and not all of them have been.
Yes, our members, if you know, I'm sure you are aware, there are many doctors and nurses and many healthcare workers who have died. So we think that if you prioritize them, you should not stop the process when we are still in the middle of it. You should be proceeding as long as there are no side effects. There are processes in place, to make sure that all the adverse effects are being recorded. And in our country, we've had adverse effects, but they are not what is being mentioned abroad. And I think we should continue with this vaccination process without any stop and go.
One of the frustrations perhaps for some people is that we just don't know as many details about the vaccine rollout program that we would like to. Now, some information's been made available. I don't think most people know where they or their elderly relative will get vaccinated. As the SA Medical Association, do you believe you're being given enough information by the health department to actually know how all of this is going to work? As you say, your members haven't all been vaccinated yet.
Well, we always have to scratch, for information. We also do not have enough information regarding the vaccination processes. We know a bit of it because some of the chairperson of the association sits in the MEC as an observer. But in terms of the whole transparency, I think we still have issues that we think that they're still missing. I mean, for example, people ask us about the prices or the money that we've paid for vaccinations. You will be told that you can't have access to that information because there are these clauses that are signed with the manufacturers or the big pharma. So it's always been a challenge having those issues. But also, what we have noted is that you get in some instances where non-healthcare workers or people who are not really at the forefront getting the vaccine. There are reports of even people who are not even in the hospitals getting these vaccinations ahead of exposed healthcare workers.
Dr. Mvuyisi Mzukwa, thanks very much indeed. Vice Chair of the SA Medical Association. Do appreciate the time on the pulse tonight.